Good evening, Europe, and welcome to Green Screen. I'm your host, Sam Murray, and over the next few months, we're going to be bringing you a wide range of online film screenings and inviting you to join our debates on the future of Europe, post-COVID recovery, and making our societies more resilient and sustainable. Tonight, we start by discussing healthcare funding, addressing vulnerabilities in European public healthcare systems. Over the course of the pandemic, our healthcare workers have been more than heroes. They have cared for us and our loved ones, doing everything they can to fight the coronavirus, often in challenging circumstances. Austerity policies have led to underfunding in our healthcare systems, and the pandemic has demonstrated the human cost of that lack of resource. We cannot thank enough those who have worked in health and social care settings, the porters, the cleaners, the receptionists, the nurses, the surgeons, the doctors, and all those who are playing a role in fighting COVID. Green Screen is about using film and culture to explore what is happening now in Europe and the possibilities of what Europe could become. We want you to engage in the debate tonight. Send us comments and questions in the YouTube chat and tweet us your thoughts using the hashtag #TheGreenScreen. This is your chance to have a platform and give your voice and opinions, so please get involved. The debate only starts here. So to kick things off tonight, we're going to show you a short film that tells you more about the Green Screen project.
Oh, hey, sorry I'm late.
Hey.
Hey, nice shirt.
Thanks.
I'm so tired of COVID. What a mess.
You're tired? Let me tell you, this is nothing compared with what I've been through. Middle-age diseases, colonization, First World War, Second World War, Chernobyl.
Sure, but we've learned all from all this. It can't happen again.
That depends on her.
We're better now. We've taken action. The pandemic opened our eyes, didn't it?
You won't get relaxed now, right? Let's not forget about gender inequality, the poles melting, the rise of the far-right parties.
Yeah, the fight is never over.
Look, I'm trying to be optimistic, but it's hard to do it when she's chilling here.
It's always me. I can't even rest on a Sunday.
It's all in your hands.
Yeah, at least you have a lifetime ahead of you to do something.
So it is now my great honour and pleasure to introduce the Secretary General of the European Greens, Mar Garcia. Welcome, Mar. Hello. Can you tell us a bit more about the Green Screen project and the motivations and aims that you're hoping to achieve with it?
Yes, so thank you for having me here. Thank you for joining the Green Screening, everybody that is out there watching. This is a project that was born during the COVID, let's say, and evolved on the second, third, fourth wave, and it's kind of It's not that other sectors are not suffering, but it's a sector that politics normally sees from very far away. So it's not that we're very connected. So we decided to come up with this project. Why don't we talk politics after, acknowledging an artwork from some director through a film, and then, we reflect a bit in a different way about political issues. And that's how the green screen was born. In the first wave and in the first European Council that as European Greens we organized, we came up with a resolution that has 8 points and how the Greens would face the responses, the answers to the COVID challenge. And that are the 8 points that the green screen is based on. Basically, big topics that somehow were always there, but the pandemic has, put more in the spotlight. And we just want to have a political conversation around it in a different way.
And do you feel that with obviously the pandemic being impacting possibly the healthcare sector greatest, do you feel that it's really poignant that we're starting today with a film and a discussion about healthcare?
Yes, indeed. One of the, let's say, the big protagonists or the big people that occupied a lot of our thoughts during the COVID, especially during this first wave where we're all super shocked, but that very silently and not so much in the public, has been dealing with the consequences of this COVID, I believe has been the healthcare sector, so its workers, but also, above all, the conditions in which they probably have and are working, yeah? We know that in Europe there was an austerity wave after this, the 2018 crisis that hasn't helped many of the sectors in general, education, but specifically health was big, in a big way touched. So I think that then COVID brought this and put them on the forefront of everybody's mind, but also I think that visibilized the challenges that we have ahead of us. So this is a humble attempt to kind of also show what the health sector is facing. I'm no one from this world, so very humbly I think that whatever we're going to hear tonight is going to enlighten us much more than what I would say. But yeah, we really wanted to spotlight health sector as one of the main topics.
Wonderful. Well, thank you for joining us and thank you for introducing the project, and hopefully you'll be joining us again as we head through this particular series. So thank you for your time, Mar.
Super. Enjoy the film and enjoy the series, and I very much hope that people will keep joining for the next films.
Wonderful, thank you. And of course, today's debate is inspired by particularly the film Burning Out, which is a remarkable documentary detailing the everyday life in the surgical department of a Parisian hospital and the imminent burnout threatening the healthcare system. We will shortly meet director Jerome Lemaire, but first, let us watch the trailer.
Incision.
Moins d'une heure. Malade suivant.
On sort en salle 4, s'il vous plaît, on sort en salle 4.
Ok, vous me faites descendre mon abcès, vous voulez pas l'endormir, il attendra ici. Ok, vous me faites descendre mon abcès.
Alors, résumons-nous, la facture est copieuse. Je dirais l'amputation, je la passe là, il y en a pour une demi-heure, chez Alice.
Pourquoi ça travaille sur 3 salles?
Mais pourquoi sur 3 salles à 4h30, dis-moi?
Moi, mon métier, c'est pas de dire non à des problèmes, à une mauvaise organisation. Mon métier, c'est de faire mon métier de médecin anesthésiste, c'est tout. Hier, j'étais dans tous mes états. Enfin, je peux dire qu'hier, c'est affreux. C'est gravissime.
Quelquefois ça pète, quelquefois ça pète pas. Variable.
Il y a eu une voilà, succession de tensions, on va dire, et ça nous a conduit à programmer une intervention au sens un audit.
C'est vachement intéressant quand même. Donc oui, j'attends l'audit avec impatience, non pas parce que je crois, non pas parce que je crois en voilà, la capacité extraordinaire de l'audit de tout changer, mais parce qu'aujourd'hui on ne peut rien faire sauf attendre l'audit. Donc du coup, je l'attends.
Je suis sûr que ça ne changera rien. On verra.
It is a great privilege now to be joined by the director and creator of Burning Out, Jerome Lemaire. Welcome, Jerome. First of all, I want to ask you, what inspired you to make this film?
Actually, it was perhaps I heard a lot of stories around me. A lot of people had burnout syndrome. But one day I received a book. I read a book. The title was is actually, because the book is still available. It's a global burnout. And I was very interested by the fact that the author, which is a philosopher, is Pascal Chabot, a Belgian philosopher. He talked about this syndrome, about burnout, as a trouble actually mirroring our society, a disorder mirroring our society. It's a burnout as a pathology of civilization, and that means that a systemical problem. And so I was very interested by that point of view on that disorder, and I wanted to make a movie to see the burnout, but burning out in action. I wanted to see how does it function within a system.
Wonderful. And do you feel that making this film actually gave permission to the healthcare workers to talk about the issues they were experiencing in the workplace?
So, of course, the authorization were very complicated to get because I was in a hospital. I was not invited, but I felt that there is an opportunity because a nurse, not a nurse, sorry, an anesthesiologist, Marie-Christine Beck, which is the main character of the movie, was connecting Pascal Chabot to ask him to come in the surgical unit to make a conference on that topic, on his book. And so I was feeling there were a problem inside that place. But it was very complicated to enter in that place, not to enter to visit them and to see people working, because it's a public hospital, and so they are used to enter people, students, and so on. But to get the authorization, it was really complicated. Complicated because I can really understand that at that time we were talking about burnout, but with a lot of culpability of, people were responsible. They were thinking we are responsible of this problem. So the management really hesitate to let me make that movie. But I tried to be very frank and to say that I want to see the situation changes, and so they allow me to enter in that philosophy, in that. So I don't sign. Yes, we sign a paper, of course, between them and the production society. But actually, it was they make me. They were trusting me. Because I was really well, I had good intentions, and I wanted to have a movie that shows a problematic that is dynamic and dynamical, of course, in a constructive way. So it was complicated, but I think that when they let me stay during a while just for scoutings, I stayed during 6 or 9 months observing people and talking to people. after that, it was impossible to close the door and to say, no, 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 we don't want a movie on that, because that would be, that was the signal. Okay, do the direction, the management won't allow the talk about that problematic or not. And so they allowed me. But I think when they do that, they were really taking, they were realizing that there is a problem with me and with people. We were all together in front of this disorder, and I think everybody wanted to change something. But when I come with my intention to make a movie, because I came with that book, Global Burnout, and I said, I want to make a movie on that topic in your hospital, they were aware about that problematic. It became to be something clear at the eyes of everybody.
And what impact did you think that you had on the healthcare workers that you spoke to and you interviewed? And there's one really gorgeous moment in the film where you ask different members of staff if they've heard about Marie-Christine's suggestion box, and you say to them, have you heard about this? And suddenly they engage and they interact even more with this idea. So what kind of impact do you feel that you had being there with the healthcare workers that you interviewed?
Mm-hmm. I take care a lot about the impact I had, because I knew, because first of all, before entering in that hospital, I really studied that disorder, this syndrome, and I was aware that when you enter in a place and you focus on a problematic, it's like when a fireman enter. I'm not a fireman, but when someone enter in a place in fire, in the same, it's burnout, the burning situation. When you open a window, you let enter some air, and of course it can be worse after that. So I was very, very prudent. I was careful about this situation, my position. But I think when I enter, first of all, I remarked that there were two groups. Some people who said, he's totally mad, there is no burnout, what is the intention of the management, why this guy enter here? And some people who denied the situation, and other people that were very happy, and that it was possible to talk. And so I tried to connect those two groups. I stay all the time in the center of the workers, and also I stay connected with people who wanted to say something about this situation, and I stay connected also with people who didn't want to talk or who didn't want to really to see that movie. I try to stay in the middle and to say, okay, I'm listening everybody. I don't want to interfere in a bad way. I really want the best for the situation. And also I was welcoming as a member of the team. And that was very, very important, to be a real member of the team. And from that place, okay, I connect people, I let them express themselves. And at a certain point, when the management went dynamizing by that story, they order an audit. It was marvelous for me, for my screenplay, for the film. It was excellent, because they remark, okay, we need something, we need help, we need to do something. And then after, because the audit collapsed, because the audit actually turned the direction from the working suffering, the suffering of workers, to a direction of efficiency, which is very classical situation. I help Marie-Christine. I affirm my side on with people like Marie-Christine who wanted to change something themselves. And that's why from a normal director, I became a character of the movie. And I said to people, okay, there is a suggestion box. You have to answer. You have to participate to this solution. I wanted to show to the audience that we are not only spectator of the situation, but we have to go to be actor, to change what we can change around us, just around us.
And I think that's so important as well as creatives, to understand the role that we can have in making change, and to see what is possible from the pieces of work that we create. And I finally want to ask you if you're still in touch with the healthcare workers that you filmed, and also what would you like the legacy of this film to be? What kind of change would you like to see happen?
So I stay very close connected with Marie-Christine Beck, with Professor Sarfati, with Bruno Halimi, with some of characters of the movie. The main characters actually were really friends of mine at the end of the movie. And so of course it's not because the film ended and the process of the filming stopped that I end the relationship. So all of them are very good, even with the COVID, all this atmosphere of the COVID. What is very nice is that the movie make possible a new experience of trying to eradicate this burnout syndrome. So now they are still working to try to eradicate this disorder, and they are also connected. Means Marie-Christine knows really better some nurses or some people, workers everywhere, and Sarfati is very famous. He was very famous, but with the movie, I think some people discover also another side of the guy. And what was very nice is that they discover that they have the whole point of view about this problematic. A lot of people are really suffering about this situation, and to be connected is very, very nice, because you can change things, and you believe you can change things. If you are isolated, of course, you believe that you are very small person, very not influent person. And so you stay at your own place without doing anything, trying not to suffer a lot. And now they are much more connecting to each other, and they are still working on that topic. Unfortunately, it's not finished, but they are still working on that topic.
And I also hope that the discussion and debate that we can have can really demonstrate the impact that your film has had, that anyone who has already watched it, which myself and all of our panelists have, already think it's such an important document, such an important account of what is happening in our healthcare systems. And we cannot thank you enough for making such an important piece of documentary for everyone to see. So thank you very much for joining us today, Jerome. And also don't forget, you can still screen Burning Out on the Green Screen website until the end of today. And please do take a moment out of the rest of your evening to watch this remarkable film. So thank you very much, Jerome Lemaire. So we are now going to move on to our main debate this evening, addressing vulnerabilities in European public healthcare systems. And earlier this week, the European Greens asked on Twitter, have you ever felt burnout from work? And we managed to have 880 responses, of which 84% of respondents said yes, that they felt that they had experienced burnout from work, whereas only 16% said no. And I think that really sends a clear message that across Europe, this is an issue in many sectors, and we need to work together and find solutions to best address this. So we're going to now have a discussion about the film and how we might address these vulnerabilities. And I'm delighted to be joined by our panelists, who will be appearing on the screen around us very, very shortly. Thank you. First of all, I want to welcome Dr. Adam Rodolewski, who is a policy officer for health and social services for the European Trade Union Congress. So Adam, if you could give a quick wave, that would be wonderful. And then I'm also joined by Dr. Alex Meyer, who is a doctor of internal medicine at Hospital Taulí in Spain. And finally, we are joined by Tilly Metz, MEP, who is the coordinator of the Health Working Group for Greens EFA. So first of all, welcome everybody, and thank you so much for joining us this evening. So Alex, if I can start with you, as somebody who works at a hospital, what were your reactions to the film? And were there topics and themes that you felt you could identify with?
Pues sí, bueno.
Absolutely. First of all, good evening. Thank you for having me here. Yes, I had the opportunity to talk to Jerome, and I already told him how happy I was to see that film. I felt totally identified with the issues of the professionals of the healthcare, anesthetists, surgeons, but not only, all the nurses and all the people in the sector. All the issues are real issues that I really feel identified with. Even though this film is prior to the pandemic, it's useful. And if we don't do anything to stop those issues, things will keep going the same. We need to realize that the cuts are undermining the healthcare systems all over Europe. And when people only highlight efficiency of the professionals and not the quality of the working conditions, and they don't think about the heavy workloads and the intense stress. And when you make your staff to go to the end, and when the audits come back, they are saying that the professionals need to be more efficient, that's a very good way of wrapping up the point of view of some of the management of the healthcare systems. And it's very visual and very patent, the pressure that the professionals of the healthcare sector are suffering. We cannot be automatized or robotized. We need to keep defending our working rights, and we need to underline that we need to keep our rest time and our workload, and this is part of the film. And we need also to keep in mind that we are workers, we are persons, we are people. I mean, we are not robots, we are not machines. When people are saying that during the pandemic we've given all we had, okay, it really fills me with pride to hear that. But please realize that we don't want to be heroes. We're just workers, we are people, we have families, we do our work, and we want to do our job in the best conditions, and that should be the aim of everything we do.
I think it's very important that we hear what you were telling us about the fact that we need to ensure that healthcare workers have their workers' rights protected. And I think the pandemic has definitely not only demonstrated even more so the value that healthcare workers have to society, but also where those limits are and how far people have been pushed to respond to it. So we really value your intervention. Thank you very much, Alex. And I'm going to turn to Tilly next. And obviously we know that resources for healthcare are not at the levels that they should be. And I wondered, what were your reactions to the film, and what state do you think healthcare is currently in as a result, as Alex says, of austerity and underfunding, as well as the pandemic?
First of all, let me thank again Jerome Lemaire, who did really a great job with this film, because I at the beginning I thought, how did he manage to be present? And the people seemed like to have been forgotten that he is there. So he was like a little mouse, and he was very present and very close to the people, and they behaved very naturally. So thanks again for this very good documentary and movie. And yeah, I found it really a strong movie that really shows what stress and anxiety, and when at a certain point you have to work, and it was already said by Alex, you have to work like a machine, like in an assembly line under high pressure. There is really the risk that of dehumanization. You know, you don't have really the time to look after the patient. You have to go into the next room and then to the next room, and I think especially for healthcare workers and for doctors, it is very hard to speak about burnout or to speak about this pressure, because they're saying, oh yeah, you have a great job, you're saving life, you have good remunerations, a good salary, so you are not allowed to complain in some way. And then there are all these other people, and that is also something the movie, the documentary shows very well. The people coming up to clean and who have only 5 minutes, so I don't know. And then afterwards, after the audit, they were saying, said, okay, you're taking too much time from one patient for another. So about these people, they are nearly forgotten. So the ones that are not allowed to complain, and the others were a little bit the forgotten one. And at one moment, I found it very touching. It was also an assistant of the nurses who is saying, I don't even know if the doctors know that I'm also having doing studies for that. I'm not just a cleaning person, but I know also how to take care of the people. So also this problem of being recognized. And so it's really now after the pandemic, because this movie, as it was said, was made before the pandemic, but during the pandemic, suddenly we saw the people showing a lot of empathy for the healthcare workers. They were standing in a lot of countries on their balcony, they were having banners, they were clapping, they were saying thank you. And in some countries, they got then one in prim, now I don't find the word in English, they got one recognition, a financial recognition, but that's not going to change it. I mean, we have to do really a paradigm shift, a systemic change, and come out of this philosophy that I must say the European Commission made as recommendation for a year. You have to work more efficiently regarding healthcare. So it was really suddenly only that healthcare became an economic good and not a human right. And that is really where the paradigm shift has to come back again. It should be a human right and not an economic good. And if we only talk about efficiency, and that was really also the audit, was people were sitting there and they were so disappointed that they were really looking, what are they talking about here again? Again, only about efficiency? And then there came this suggestion proposal box. And then there was one of the nurses who said that, okay, I did this with my children also. You know how a very simple thing, they were so happy afterwards. Afterwards, you see also Mary Christine and all the people when they looked at the papers and they were like lightning. Oh, we're going to make this together. We're going to make the change. So a very simple things that we use with our children to make the people participate into the process. And that is some of the really important lessons. And Jerome Lemaire said it. He succeeded by this documentary that people listen again to another, communicate again with one another. And then at the end, they really saying, and I'm happy to hear that they did something out of it, that they were communicating and listening. Finally, people could write on a paper what is hurting them. And it's really, so that was my first reaction. Sorry, I was maybe a little bit too long on it.
No, thank you very much. And I think you raised really important points about these buzzwords being used like efficiency that really are not connected to a sense of humanity. And I'd like to bring Adam into the conversation now to not only offer your thoughts on the film, but when we had a conversation earlier this week, myself and Adam were talking about this idea that in the healthcare sector, there needs to be more responsibility taken by the employers. And that often we talk about mental health being something that should be addressed in terms of burnout, but it's not merely individual mental health, but the responsibilities, the psychosocial responsibilities that should be taken by employers. And I want to invite Adam to reflect on that, and also if you could offer any of your thoughts on the film as well.
Yes, thank you very much, Sam, and thank you very much for inviting me at this very important film screening and discussion. So maybe for clarification, I'm a policy officer, but in the European Federation of Public Service Unions, representing public service unions, and in particular healthcare workers. I would like to also echo my colleagues and congratulate Jeremy for this very important movies, which was quite old movie, no? I think from 2015 and 16, but we already show there the problems that we are facing in the hospital sector, in the healthcare sector. So we could really imagine now being in the third wave of the pandemic, or fourth wave of the pandemic probably coming very soon, that those problems really exacerbate. And as we know here, the burnout is part of the stress. So it's actually the end of the, having a really stress situation in the work. So it's done, people cannot work any longer, but this is still related to occupational health and safety. And this is still the issue of the psychosocial risk and stress. I would like to comment on this more, but I think now you could see that EPSO published on the 12th of May, International Nurses Day, the statements regarding in particular the stress at work and the issues of burnout among our workers. I would like to also make some other points when I really come back to this issue of stress, which is very much related to working condition in general. That, for instance, Tilly was saying that, in France, the doctors are paid very well, but it's France. We should not forget we represent here European Union. So when we really look at Romania, for instance, in Poland, we know that even the doctors, even the very well-qualified doctors, are not really paid a lot. And also when we look on all Central Eastern Europe, that's in a sense of particular importance for me because I come from this area. So in this film, what we could actually see is that the workers are complaining, that's good. But in many cases, we see that the level of stress, a lack of investments and cuts lead to a situation where a lot of workers left Central Eastern Europe and moved to Western Europe. So we know that that's very much interconnected. And again, as we have this in the beginning, this applause is not enough. I mean, applause, a lot of applause for our workers, but we know in EPSO, as well as Alex was saying, that of course healthcare workers are the heroes. They are heroes because they are committed. This is why they choose this occupation to provide health and to heal our citizens. But applause is not really enough. We really need to ensure that they are provided with the quality working condition that include decent pay. And we already see it in some countries, like now countries that we are together, some in the UK that the government didn't. In England, only proposed 3% of the pay rise, given that the inflation is 4%. So you need to be decent wages, but also you need to be a decent occupational health and safety. One point which I really want to underline before we go further, it's that we are all, as you said, one team. So we have the doctors, we have the surgeons, but we also have nurses. The majority of them are the healthcare assistants, who are very important, but also administrative personnel, we have porters, we have cleaners. And one of the most striking points for me in this discussion in the movie was when the main character was saying, we are complaining here, but I really wrote it down. No one is interested in the girl with a mop. So I think it's really show how important it is to have this one team approach and to ensure that what the character was also saying, that I also make a note of this because it's a very good movie, Jeremy. The condition of work deteriorated, but the work, the expectation of the work not. So actually you could see a massive burden put on the healthcare workers to actually to fulfill their commitment, no? Because it's actually commitment. This is why they become healthcare workers. Therefore, on this case, it's important that burnout or mental health is the responsibility of employees. We have in place a directive from 1989, the Framework Directive, which says that employers need to ensure healthy and safety working conditions. And one part of that is, of course, psychosocial risk and stress to address growing burnout. But I think that's all from my side. I think in this part. But again, I think it's important to link occupational health and safety burnout with a general working conditions. And in the movie, we actually see that the character was saying that there is not enough personnel. That was one of the outcome of this suggestion from the box, no? That not enough personnel that we need to address, because once we don't have enough personnel, then we have more stress.
And that's actually a point that has been raised in some of our Twitter interactions that we've done this week already. Quite a few people have talked about the need to have more capacity within staff to be able to achieve what needs to be achieved, and that it should not just be about changing that efficiency, but as you say, understanding the occupational health and safety of the work environment and how people should respond to that. So thank you for your contribution, Adam. And I think this film really captures the sense of what burnout in a hospital can look like. And we're now just going to cue up a short clip from the film that really demonstrates just that. So let's now take a look.
Qu'est-ce que vous voulez? J'ai pas le temps. Qu'est-ce qui va pas?
Si on a un problème de vélo, que vous me dites.
Non, j'ai aucun problème. J'ai aucun problème.
Je suis quelqu'un d'assez disponible.
Je vous dis, il n'y a aucun problème. Écoutez-moi. 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 Je suis encore le médecin et le chirurgien.
Je ne refuse pas. Je ne peux pas discuter de traitement.
Vous nous faites passer les malades en consultation d'anesthésie.
Non, moi je suis infirmière anesthésiste. Je ne fais pas passer les patients.
Mais votre boulot, c'est d'être près de la malade.
Je suis toujours près des patients.
Non, vous étiez là-bas pendant toute l'opération, de la rassurer et de lui mettre de l'oxygène.
Parce qu'on ne m'en a pas donné l'opportunité, monsieur.
Il n'y a pas d'opportunité, c'est votre boulot. Attendez, vous rigolez ou quoi? Je vous dis, c'est votre boulot. Et il n'y a pas de discussion. Mais vous n'avez pas à ne pas travailler avec moi. Écoutez, je n'ai pas à discuter. Je fais mon boulot. Vous faites le vôtre.
Je me suis toujours exécutée comme
mais vous n'avez pas fait votre boulot.
Mais je vous demande, s'il vous plaît, de ne plus me parler comme à un chien.
Mais je ne vous parle pas comme à un chien.
Je vous le
Madame,
demande.
quand
je vous le demande.
Mais attendez, vous rigolez ou quoi?
Non, je ne rigole pas.
Je parle en français.
Moi aussi, je parle en français.
Et je n'ai pas parlé comme un chien.
Si, monsieur, vous m'avez parlé comme un chien.
Mais c'est pas possible, ça.
Et ce n'est pas la première fois.
Votre boulot est d'être près du malade.
So as you can really see in that clip, there are all different kinds of dynamics happening within healthcare workplaces at the moment. And not only is there this sense of struggling in terms of communicating with workers from different areas of the healthcare system, but also really a problem in terms of the power imbalances between different actors within that and how they kind of connect as well. So we're now going to turn the debate to really pick up on something that has been discussed already, which is about how healthcare has been managed. And in fact, we've already had a question that's come in that I would invite all of our panelists to respond to when you come to. And somebody has asked, how concerned should we be of some EU countries slowly switching to a more American approach to healthcare? And this idea that the American model is very financially driven, not kind of patient-centric. And there are a whole wide range of issues, particularly including actually accessing health insurance and getting healthcare at all. So I think there's a concern from some of our viewers that we may be slipping into that direction. But I would like to start out in this section with Tilly, if I can come to you first. And across Europe, austerity has really led to not only this underfunding, but this challenge of healthcare systems being managed not necessarily by the right people. So I want to ask you, do you think that healthcare systems are being managed by the right people in the right way, or does there need to be any changes to how healthcare is managed?
You know, I think there are some differences between the member states, of course. Some have a governance made of doctors and of more economic, financial people. One have a doctor at the top, and then a whole financial staff on the other side who is advising them how to be more efficient. But in general, I must say, my dad used to be a director of a hospital, and now my brother is. So I'm quite, it's a discussion on the Sunday lunches, of course, also. And I'm really worried sometimes that in general, that we are going more and more considering a hospital, and you see it in the movie very, very well, like a private company. And it's really in the logic of to be profitable. And so they reduced staff. And I think that's something we see all over Europe. I was also looking a little bit for today at the figures I found. When you consider, for example, Portugal, there has been between 2010 and 2012 alone has been the investment was reduced by 27% alone in that time. In Greece, between 2010 and 2016, 40% was reduced health expenditure. Regarding Italy, for example, the acute beds were reduced by 13% between 2010 and 2015. So you see, there was really a drastic reducement of the investment, but also shortages then of staff, really more workload, a lot of stress. So that is something we see throughout all over Europe, even if the government and the management systems might differ a little bit. And that's something that I find very worrying. Added to that, you have also steps to more outsourcing certain services, to privatization. And so I think really that the pandemic showed that we have to reconsider this whole system and to listen really more what the demands are. And coming back to burnout, etc., to work also that we have prevention, that we have treatment, that this is not a taboo anymore, and that we should speak about it, and also considering the very importance of work-life balance. If you look at assessment of hospitals today, they are mainly focusing on the economic. I would like to have assessment of hospitals that really consider also qualitative indicators. How are the people going who work there, and all the persons working there? So, and that's something I think we really have to reconsider. And there, even if health is mainly a competence of the member states, that does not mean that the European Union cannot do anything. I think really definitely we should raise awareness, we should campaign, we can make an exchange of good practices, etc. And there are levels also where we can work better together, guarantee cooperation. The pandemic showed also that we are able to show more solidarity also between the member states. But on the other hand, we also saw even that the symptom of reducing staff, of the austerity, we paid also the price. And my brother was often coming home and saying, and that was at the beginning of the pandemic, the people in the hospital are exhausted. They are doing their best. They try to be human, to take the needed time, but they were just so exhausted. And when he spoke and he gave me examples already before the pandemic, sometimes he illustrated situation where I thought, okay, and we are here in Luxembourg in a rich country, entre guillemets, but really to put another assessment in the future regarding the hospitals, not only considering this economic, that would already be an important step forward, and to speak about qualitative indicators and not only quantitative.
That's such an important point to look beyond those figures that are being used to kind of judge how human resources are distributed and used in what are and what has turned out to be very, very inefficient ways. And some of those statistics that you were sharing with us about those cuts in healthcare spending are quite staggering to see those very large figures as well. And I think that also you touched upon the point about privatization, which is possibly why our audience member who asked about the US has really worried about that there is a fundamental shift into more private contracting and outsourcing as well within the healthcare sector that isn't necessarily to the benefit of those systems and might look good as a statistic, but actually in practice it's not. And Adam, I would like to turn to you next, because obviously over the course of the pandemic, as Tilly said earlier, we've seen all of these politicians come out on their doorsteps and clap and cheer for healthcare workers. But many have not actually sought to change healthcare policy. And as you mentioned before, here in the UK, there was the insult of only a 3% pay rise, which barely keeps in line with inflation and creates all kinds of issues in itself. So I want to ask you, what do you see as the challenges in the way that healthcare services are actually managed and dealt with, perhaps on a governmental level, but also on a management level as well?
Yes, I mean, I also agree what Tilly was saying about these unprecedented cuts in spending on healthcare in general, and that the trend is very, very, how to say, very negative in the sense that we could see that health become more and more commodified. We observe it, a lot of initiatives to commercialize healthcare. We could see that in some countries there is a lot of outsourcing of the healthcare workers, and this sort of idea that something which is private is better, which is actually not true. We have a lot of evidence that when we start doing this, this is all of taxpayers' money, and we all as society will actually pay for that to make some profit for some international companies, which at the end of the day are not even paying taxes now because they are, some of them, based in those tax havens. So I think the most important thing is to underline that health is the right. So we have a right to care, health. This is in a common interest. And we already have a lot of European documents on that issues. Now we have, for instance, the European Pillar of Social Rights, which was adopted in 2007. And the pillar says in the point 17 or 16 that health is important. So we really need to ensure the equal access to health. This is also one of the development goal of the United Nations. So I think that is very important to underline this, and also to ensure that, as we already mentioned, is that we very much linked occupational health and safety with the working conditions, because they are very very much interconnected to that very important topic. Sorry, Jeremy, what was the question? Because I really tried to really sort of go back to the previous points. Can you just repeat the question?
Yes, it was also about reflecting on how governments can, for example, change their approaches if they're willing to go out on the doorstep and clap for these healthcare workers.
Yes, that is what actually what I actually was saying, that here we need to have a long-term investments into healthcare. But what we really need to understand is just the health, on the spending on health should be not like budget expenditure. This is actually investment in terms of the quality of health of the European citizens, but also in terms of ensuring that we have a number of healthcare workers, because what we are actually seeing now that we suffer from shortages in the healthcare occupation. There was a very famous report from the European Commission from last year, and it shows that the healthcare workers, all related to healthcare, are in the shortages of occupation among the 22 member states. So one of the shortage of the occupation is our healthcare related occupations, then we have the IT, and then a craft occupation. So we really need to ensure, and this is the role of the government in terms of spending, that we invest in retention and recruitment of the healthcare workers. So, but COVID pandemic show really disastrous situations, as Tilly was saying, that the workers cannot do it now. They are under stress. We also see from our affiliates from Unison, there was a survey done already in March this year, saying in the London region, saying that half of the interview healthcare workers are considering leaving of the occupation. So we really need to act now. We really need to invest. So change the narrations that spending on healthcare is investments, and to ensure that we support healthcare workers. So we can to ensure that we address the issues of retention, because we have obviously a problem of retention after the COVID pandemic, but also recruitment. So we need to make sure that this occupation is attractive for the local population. Because another issue which is sometimes not underlined in this discussion is that we cannot rely on the workers coming from outside the EU, because then we could contribute to this, brain drain. We need to ensure that this occupation is being attractive for the local populations. And to make this resilience, I do think we need to have more healthcare workers than nowadays, because that's the only thing, to have an adequate needs-based level of staff personnel. And another one, and that's a role of the social dialogue on the European level. EPSU is conducting, or is a social partners with the employers organization. It's called HOSPIM, which represent the biggest employers in the hospital sector. And we are always saying this, that, the spending on health is investments, and therefore we need to really ensure that the governments will invest more. One of the points that I really want to underline here on the EU level, because remember we have this discussion in the beginning that there was the EU for Health, the fourth EU for Health strategy. The Commission promised, I think, 10 billion euros, and the Council cut it to, I think, 2 billion, which was absolutely outrageous. Therefore, EPS organized a demonstration in October last year. We now have 5.1 billion spent for EU for Health project. And one of the aim of this project is actually reinforcing the healthcare workforce. So I think it's really important to ensure that the money that will be spent to support healthcare workers. And also the money coming from the EU recovery funds, this Next Generation EU, are actually used to spend on the healthcare workers. From the information I have, it's not very positive in a sense, because we see that's only about 10% of this Next Generation EU will be spent on the healthcare, and I don't think it's really enough. So it's also the role of the governments to ensure that they will invest in recruitment, retention, and training of healthcare professionals.
In fact, we've had some of our audience watching leave some comments that really connect to what you were saying, Adam. So somebody has put that we could see burnout very much as a societal dysfunction rather than an individual ailment, as something that we need to work on together and to tackle. And there's also a comment that also there is an irony of the place that should heal people itself being a source of stress and illness. There's some really useful comments that really were connecting to what Adam was saying. And finally, I would like to, Alex, bring you in. And quite often, healthcare is talked about as an economic good rather than a human right. And I think Tilly was saying this before. And as a doctor yourself, do you ever feel healthcare and how it is managed has become dehumanized?
Sí, bueno, a ver, la verdad es que creo que
I believe, and I totally agree with what you have said. Of course, saving money sometimes have the other side of the coin of dehumanize healthcare. We are no machines, we are just healthcare professionals. We have to keep our rhythms, our rest time, and there are certain things that cannot be measured. We cannot measure the time that you need with certain patients. For a patient, you might need 5 minutes, whereas for other patients, you will need half an hour. So you need to give the right time to every patients and we as professionals feel that we are mistreating our patients, and on the same hand, we feel that we're beaten up. And we have also been mistreated by our management because we aren't given the right tools in order to treat our patients and to carry out our job in the best way possible. Sometimes has been said that the healthcare system can be considered like an economic asset. And to that sense, I would like to say that the health of the people is not an asset, must be a human right, and every citizen must have access to right healthcare system. But we could never forget that even when we consider it an economic asset, we need to invest in that asset, because sometimes we forget that health is costly. And of course, the public health system normally given provided by the state has a cost. Otherwise, people have to pay from their own pockets. It's already been proven, and the state is a big example. And Spain, that we have public access to healthcare, would we spend to the GDP, according to our GDP, is less than what the United States has to pay, has to expend. So even in the case of public healthcare systems are more effective and are more cost effective than in the where in countries where there are private, like the United States. So even when we consider the healthcare system an asset, the rational and the more sensible thing is to pay from the state. It's more efficient, it's cheaper. We save money doing it from the public expenditure and having it included in national budgets, in public budgets. We also should consider that when we have a solid healthcare system, our workers are healthier and our societies are happier, can work longer, and it's cheaper. So there are many, many advantages. The only disadvantage is that it's supposed a cost, but it's not a cost, it's an investment. That's why we believe there is no doubt on how beneficial having a solid and a healthy healthcare system is. I also have some story background of unionism, because we still need to fight for our rights. We had a long strike last year, and sometimes we realize that many issues are that the healthcare professionals believe sometimes that we are responsible for our patients, because sometimes we believe if I can't go to work today, this is a patient that it's been damaged by me not being at my job today. And we feel guilty if we don't give the best care ever. And if you know that there is a long waiting list, you want to do your best and do as many surgeries as you can so that this waiting list get shortened, because we believe that the people damaged by we not doing our utmost is our patients, and we don't want our patients to be damaged at any cost. And that's why we ourselves overload with work. We kind of make our job even more difficult by doing that, because we feel guilty if we don't.
I think that's also, you know, really disheartening to hear that you feel that you have to take on all of that guilt yourself when really it's the lack of resource. And as you said, that you are not given the right tools to treat patients. And I think that it's disheartening to hear that you feel you have to take on that personal responsibility when it is a system that needs to change and need to be resourced. And I think we all have a responsibility to ensure that we campaign and ask for that change to happen within our respective nations and our respective healthcare systems, and that it should not be the healthcare workers having this burden that really is not their fault. And I think it's really important we say that, but thank you for sharing your thoughts, Alex. And we've had more comments and questions about this. We've had questions from Marta saying that all of these needs that Adam has mentioned in his contribution are closer to happening potentially now than before the pandemic. And do we feel that the pandemic has put the healthcare in the centre of the public agenda? And there could potentially, be hope that things can improve now that healthcare is so prominently discussed as well. And for this final kind of section of our discussion today, I want us to kind of reflect on one particular moment in the film where Marie-Christine, who is almost the protagonist of this film, as Jerome said, proposes this idea of the suggestion box. And this is the chance for a bit of grassroots action. And the folks at the European Greens put out on social media several questions this week asking what kinds of changes you would like to see. And we've had many different responses that I think were echoed in things said today. So responses that we have had included reasonable staffing in industry to better manage workloads, in many cases would help, to have rest times for staff, to support unions and the trade union movement, to support a healthy work-life balance, to actually talk to workers and listen to their concerns, to have less working hours, to have better paid work, for there to be potentially the introduction of basic income, to ensure that there's worker representation and access to mental health services as well. So I think there's many ideas out there of how we can try and make healthcare and the systems around it better. But I would now like to ask all of you as a final question, if you can tell me one change, and I know there's so many and it might be hard to pick just one, but if you could tell me one change that you would put into the suggestion box. So I'm going to come to Tilly first. What would be the one change that you would put in the suggestion box?
Yeah, it's really a very hard question because I want to change so many things, but the main thing, if I have to choose one, is really to strengthen the social dialogue and to really make the people who are working in a company, in a hospital, or especially, as we saw in the film, to make them participate in the process of their working organization and to really listen to them. So that, I think, would be my main demand.
Thank you very much, Tilly. And Adam, if we can come to you next, what would be the one thing you'd put into the box?
As a trade unionist, I will also have like a list of demands now, which are very important for us. What I wanted to also say here that what Alex was saying, that's really crucial, and until the crucial role of social dialogue. No social dialogue when you have a strong trade unions to which you could go and ask for advice, and also employees' organizations negotiating this. What I will put there, but it was already there in this box, and I made a note when I was watching this film. One was not enough personnel, and I think this is crucial for us, in particular for healthcare workers across the globe, that we need to have adequate needs-based level of healthcare personnel to address the issues of stress, because if you don't have enough personnel, you have issues of stress, musculoskeletal disorders, work-life balance. So we don't want healthcare workers to work more than 40 hours. Why they couldn't work on like 30 hours? So that's really crucial. And I think it already was then mentioned in the regulation on health emergencies that there's sort of like a stress test, how to prepare the healthcare system. As one of this is also to have like adequate number of healthcare workers. So that's important. Another point before we finish this very exciting discussion, we should not also forget about long-term care. I think we need to have the integrated approach to that. And I think maybe next movie or maybe next meeting that Green will organize will be also on the workers in the long-term care sector, which was completely forgotten. And then we see the disastrous effects on the deaths of the people in care homes. So I think that's important to ensure that health workers are also in health, but also in long-term care and social services. That's all from me.
Thank you very much, Adam. And finally, we'll come to you, Alex. What would be the one suggestion that you would put in the box?
Well,
ahora sí, ¿eh? Yo, nada, iba a decir justo que nos escucharan, pero es justo lo que ha dicho Tilly.
I wanted to be heard, and that was Tilly said, and I also wanted to face the lack of personnel, lack of staffing, that was Adam said. So my suggestion would be that investment on healthcare is not a cost, it's an investment. It's not wasting money, it's investing money. So, and then let me add a second part to it, that also the healthcare professionals need to be taken care of.
And I think that's such an important and really poignant point to end on today, that message that putting money into healthcare is an investment. And it's not just spending, it's really investing in all of our futures as well. And on that note, I would really like to thank our panelists, to thank Dr. Adam Rodolewski, to thank Dr. Alex Mayer, and to thank Tilly Metz, MEP, for joining us today. And it's been such a privilege to have you share your perspectives and experiences, and thank you for joining us this evening. So we will now be moving on to the very last part of our green screen event today, which is our artistic spot, where we put under the spotlight a creative response to our topic of discussion to show how art can make change in society. So we're now going to watch a video about Iris Serrano and her artworks at the Hospital General Universitario de Valencia. And this is really artwork that empowers women and allows them to have an artistic and creative expression of their healthcare experiences. So now I'm going to pass over to watch this video.
Soc Raquel Herbàs, comare i actualment supervisora del Hospital General de València. La decisió de dedicar-me a la sanitat no va ser d'una manera conscient. Va ser el millor que em va passar mai. La idea de fer un mural dintre d'una àrea tan sensible en l'hospital com és les sales de part va ser algo que va començar a gestar-se en mi des de feia anys. Iris Serrano no la coneixia personalment. A través de les xarxes em vaig ficar en contacte amb ella i només amb una conversa telefònica, crec que només vaig necessitar 3 minuts, si cal, per convèncer-la que vinguera i m'ajudara a transmetre mitjançant el seu art allò que volia que les dones sentiren quan vingueren a parir a l'hospital. L'art és terapèutic en cadascuna de les seves formes. L'art media les nostres emocions i quan més positives siguin aquestes emocions, més fàcil és la recuperació dels pacients. Pense que l'experiència del part viscut en un lloc on tenen la possibilitat de veure, per exemple, un mural d'Iris Serrano fa que la dona s'empoderi. Necessitem dones empoderades per a tindre la seva vivència del part com elles vulguin. I crear un lloc aixina, amb un mural com per exemple aquest, d'una artista empoderada i feminista, fa que les dones se senten lliures per a manifestar què és allò que volen, què és allò que necessiten. Soc Raquel Herbàs, comare, i pense que l'art és transformador i necessari i vital en les nostres vides.
I was really struck there by just how beautiful those images are that really allow people to connect with their own personal experiences of giving birth. And you can find out more about Iris Serrano by going to the Green Screen website, which is thegreenscreen.europeangreens.eu to find out more. So finally, I just want to say thank you to everybody who has joined us tonight. For those of you at home who are watching via YouTube on many devices, to Jerome, the director of Burning Out, to our wonderful panelists, to Iris for her video, and of course to Mar Garcia, who introduced the project at the beginning. And I also just want to say a big thank you to the team at the European Greens and the production team for helping us put on tonight's debate. It's taken a load of hard work and preparation, and we cannot thank you enough for helping us pull this together. As I've said before, this is only the start of the conversation. This debate by no means is the end, and I would really encourage you to reflect on the themes that our speakers have said, and feel free to tag and engage with us on social media to keep that conversation going, as we want to be able to give you, through the green screen, a platform for your voice to be heard. So we will be back with our next film in September. We'll be making an announcement of what that film will be closer to the time. So make sure that you follow European Greens on Twitter and Instagram, and also go to thegreenscreen.europeangreens.eu to find out more about what is coming up in the series. And I will see you next time, and hope you stay safe and stay healthy and have a great evening. Thank you very much.
Thank you, Sam. Bye-bye.